I would like to open with a round of one question from me to everybody, and I would like you to be brief that we have a lively discussion. So let's start with you, Christa. You took the, let's say, the factor out of the the IGIT factor, the factor, You deleted the taboo talking about colorectal cancer. You changed a lot about public reception in Germany. Why did you give us some moments, how you changed that German public life in that issue?
Yeah, I would give you a short insight into what we do. We started in 2001 after my son's death from colorectal cancer. He died with only 33 years old. And Hubert Burda and I, he's his father, we started a foundation then. And the mission of the foundation is to educate the public about the benefits of early detection and screening of colorectal cancer, because this is the one cancer you don't have to get. Also, if you have a hereditary risk, you don't have to get it if you get a regular screening. So we took all our magazines of Hubert Burda Media and placed two-page ads throughout a whole year. And the next year, we initiated a Colorectal Cancer Awareness Month, a National Colorectal Cancer Awareness Month. United States had done that already. Yes. Carolyn, she did it in United States, and she was one of my role models, and that drew a lot of media attention. Everybody had told us we would never be able to get that topic into the public. And even the media would not be willing to write about it. The total opposite was the case. And at the end of the year, at the same year, 2002, to our big surprise, the national health authorities decided to pay for a preventive colonoscopy for everybody beginning from the age of 55. So that was the direct impact of the first National Cancer Awareness Month.
Thank you, Christa. Brigitte, let's continue with you. The German Stroke Help Foundation is turning 20 next year. You achieved unbelievable things. Because of your foundation, we have stroke units now on basically all German hospitals. I mean, after having succeeded so well, what drives you now? Why don't you go to the beach?
Well, it's interesting because I'm coming from a publishing company, and you ask, okay, why do we care about chronic disease management? That's basically what it is. It's interesting because it's a huge societal problem. My mother founded the foundation 20 years ago, and from a personal experience from my little brother when he was 15, he had probably a stroke. They never really detected that, but probably it was a stroke. And then she founded the foundation, and now I think it's finding structures within the system that everybody in the US, it's much more common sense, that everybody is treated wherever he is with the same quality and the same, so to say, processual management. And that's basically what we don't have in Germany, and we're working on this care management.
Carolyn, you're running America's biggest cancer prevention foundation for 25 years now. Respect for 25 years. Hey, give her a big hand. She's running it for 25 years. That's really something. You support cancer research, education, community outreach programs nationwide, etc., etc., etc. That's a lot. Where are you heading? Aren't you running out of steam after 25 years?
Well, no. Back in 1984, my two young children and I moved in and took care of my father while he was dying. As I say, he was losing his life 1 inch at a time to metastatic head and neck cancer. And I was devastated after he died, but I was also quite angry and frustrated because I realized that his cancer was really preventable. And the choices he made, his lifestyle choices, made him a prime candidate for developing cancer. He was a case of cancer waiting to happen. So the more I read and the more I talked to people, the more I realized that no one was focusing on the prevention of cancer as the way to really attack this disease. Everyone was focusing on a cure, finding the magic bullet. So I decided to establish the Prevent Cancer Foundation in 1985. If you fast forward to now, 27 years later, you'll find that we have invested more than $130 million in programs that advance our mission of saving lives through prevention and early detection. And I believe we've made some great strides, but I think great challenges remain. And I look forward to being able to discuss some of those challenges with you during this conversation.
Thank you. Cornelia, you have lots of titles. You're a professor, a full professor, you're a medical doctor, you researched a lot, then you got a call, you went to Seattle, you had it all. I mean, you had like a big research facilities, billionaires next door, you lived in the US, you lived the big life, and then you came back to Germany. Why did you do that? What made you come back?
Well, it kind of was a little bit my midlife crisis. You know, at some point you really have it all. I have all that, and I also had a wonderful family with 2 little boys. And then I thought, well, where can I have the largest impact in the future? And cancer prevention has quite some status in the United States, and it had very few fighters. For example, Martina in Germany, and there was an opportunity to come to the National Center for Tumor Diseases, which is Germany's first comprehensive cancer center, and to build up prevention there. So I'm heading the division of preventive oncology. And I came back and I started a very interdisciplinary team, just like this conference, bringing together medical doctors as well as statisticians, sports scientists, nutritionists, pharmacologists, geneticists, psychologists, and they all together address with their smart brains the question of how can we have the biggest impact on cancer prevention in Germany. And so that has been very rewarding, but also a bit of a culture shock.
Okay, let's talk about the culture shock later. But first, Martina, you know, I really love you that you really created all that movement against the smoking, because I don't like smoking, to be honest. You know, but you know, when you started, everybody loved smoking. Everybody must have hated you, must have put up lots of hurdles in front of you because the industry was against you, politics was against you. I mean, how did you get the power to do all that? You don't look like Hercules.
Well, I think this is for us as for cancer research and scientists, it's very clear that tobacco smoking is the most single preventable disease. And not only for cancer, but also for cardiovascular disease and for other lung diseases. So our mission was very clear when starting 15 years ago. It was an initiative by the later Nobel Prize laureate Harald Zuhausen, who gave me this duty to do something on tobacco prevention and control in our own country, and not only working on research but also in communication. So prevention is it's a communicable fact, and we did this.
Mm-hmm. Respect. You know, we would like to talk a little bit on the prevention. You did a lot of things, you achieved a lot, but if I look from left to right, you're all female. You know, it's DLDwomen, I know, but I think all men are created equal. So what do you think? Could a man have done the same thing, a male? Brigitte. We have a very special relationship, fighting.
He's always teasing me, that's the background to it, so that's why he is addressing me first.
But
no, I think women do it differently in that sense, as maybe it's very unusual that women in a very scientific arena come from a non-profit background and saying, we know how to do it, we know how to basically get something done, get something into the system, try to build up prevention process, or basically modules or different products and services for prevention. And I think men have it's a very man-driven world in that sense. And to get the respect and the dialogue in the first run, I think you have to be very diplomatic and firm. But always with a kind of humor, and that's very important, that when you hear a no, you hear it, but you still move forward.
But men can be diplomatic too, I think, Carolyn. You're from Washington, D.C. You know, how is it in the U.S.?
I think men can be diplomatic, I agree, but I think men
That's
also...
good, thank you.
They also want to be heroes, and I think throughout history, throughout mythology, throughout literature, the arts, it's always glorifying the hero. It's those who vanquish disease. It's those who conquer their enemies. It's the sports heroes who score the winning points. It's not the ones who play defense. It's not the ones who avoid war. It's not the ones who prevent disease. So I think women are heroes in a different way because we're willing to be heroes in a defensive way. And I think by defending against cancer, by helping prevent cancer, we're doing something very heroic, but I don't think we care quite so much about getting the glory. And I think...
Very noble, Cornelia.
Well, first of all, I believe in equality. I think men can do most things that women can do, including vacuuming, dishwashing.
Thank you, thank you.
So they can do prevention as well, as there are many great colleagues in the US, but they tend not to do it. And I have to say, from my perspective, actually, I had a major advantage coming into the German system as a woman because I was not a target for the hierarchies as much as a man would have been. So I've been kind of slipping through the cracks sometimes and have been quite successful through that as well.
You just said they don't tend to do that. Why don't you outline that, Christa?
Prevention is just not a topic for men, and especially colorectal cancer prevention. They fear. I think it's a quite inbuilt fear of homoerotic thing, like.
Really?
Yeah.
Really, you mean like?
I can tell you. There is a scientist at Heidelberg University, and she did a lot of research on men and colorectal cancer screening. And one thing she found out is women, if somebody in the family has colorectal cancer, it needs just one case of colorectal cancer, and they go for screening. With men, it needs 2 or 3 cases. So that makes a very big difference, even if it's your father, your brother, or a close friend.
Wow. So does that mean that men are not as heroic as we think? I mean, you are... Please be nice.
Well, I think principally prevention is really a communication tool, and I am convinced that women are much more stronger in communication than men. I must really say it.
Okay, I can live with that.
It's a good. I think it's also proved by good studies.
Mm-hmm. But everybody can have a stroke. So, Brigitte, what do you think? Is it even like men, don't like to talk about it? As we just try to, let's say, avoid it?
When my mother started the foundation 20 years ago, it was not basically accepted as a disease for the mass or a volume chronic disease. At least not in Germany. And it happened, it was an old people disease, or it only affected people over 60. That was the common sense. And when we got more and more into the research, we saw it happens basically to all classes in terms of age. Even children during pregnancy can have a stroke while the mother is pregnant. Children have a stroke, or especially after the first year, after when they are born. And many young people get a stroke in the meanwhile. So it's not only about an old people, whatever disease. And that changed. And I think the campaigns we did to that in terms of prevention, that's not only personal health, it's a systematic approach. That the costs, it's not only talking about prevention, it's a cost factor in the society. You can put a lot of money in repairing something, but when you prevent something, it has an effect in terms of economic and societal preventional change in the structure. And that's something we have to get aware of, and I think we're working on this. We have now 250,000 people each year having a stroke. By 2030, 2050, we have 700,000. In the US, it's even much higher. And we have to take care of these people. And every third will have a stroke. So I think it's something we have to be aware of in terms of caring people when they're getting older.
Does it mean we have to have a female person around to look on these issues? Is it like that?
I guess so. It's it's a topic which is much more for women because they are educated as being a mother to care for their children, for the family. They go to the doctors with their children, so it's inbuilt. Mm-hmm. And for men, prevention does not exist. I can tell you of my experiences with men. It's
okay,
impossible.
give me some experiences of give me some of your experience with men.
I can tell you one story, one short story. It's a couple, and I've known them since years. She's always, when I met her, addressing me, "Can you please talk to my husband to undergo screening for colorectal cancer?" And all the time I did, and he never went. Then the last time when I approached them and he said, "No, I haven't been yet," I said, "Next time when I meet you, I don't know you anymore and I don't even greet you." And you know what? He went.
Okay, could you, maybe we have lots of people here, everybody knows somebody who's male and has to go, of course, to do some prevention. Could you give me like a tip or a hint, how to persuade somebody to actually go to colorectal or whatever? Cornelia?
Well, one aspect that actually is very good in cancer prevention as well as cardiovascular disease prevention is exercise. And I would like to publicize much more that exercise raises testosterone levels, which is something we might not want, but is highly attractive to men.
Carolyn, your tip, your hint. What do you tell everybody? How to prevent a male person to undergo some prevention?
Well, I think we just need to make the appointment for them. I mean, women are the gatekeepers. We're the gatekeepers for our family's health, right? And it's a matter of really putting a noose around their neck and sometimes just drawing them right there. But for the women to be proactive, to make the appointment, to drive them there, to do whatever it takes to get them to go and get screened. It was pointed out this morning in one of the talks that 80% of consumption is done by women. Well, I would argue that probably women are 80% of the healthcare consumers as well, not just general consumers.
But does that mean there's a female approach to politics? In general, there's a health politics? I mean, you really strong-arm German politics down.
Well, you must be well prepared, I think. What we try to do and what we succeeded is to change legislation. Mm-hmm. And this differs, I think, quite from a behavioral issue. And to change really the legislation, you must be very good in providing the right data at the right time. And then to communicate this to the media and to the public and to politicians. So what we created is we went from science and we were coming from science and went to politics and to the media, and this was this transfer that was quite successful, but not successful enough. I think Bavaria is a fantastic, good example. But the rest of Germany is not so good. So what we want that the other states, the other Länder will follow the good Bavarian example.
She is so good in this. She just told me that the new minister president is a woman in
North Rhine-Westphalia, Hannelore Kraft.
North Rhine-Westphalia. And she said, okay, they have a new government, new minister president. I'm going to approach her and convince her to do it like the state of Bavaria. And yesterday or the day before yesterday, they announced from this North Rhine-Westphalia, they announced that they would have the law like in Bavaria now. So
You all are very successful. Brigitte, let me ask you, was there a moment when you really thought about giving up? Let's say, well, I can't do it anymore because there are too many hurdles, too much pressure?
Well, the pressure was quite high, especially from tobacco lobbyists, and also they tried to got very personal, and they got very nasty emails.
Really? Like
and
what?
blogs
Like what?
and so on.
Like what?
Some shitstorms too. And I must say I'm very proud to have also a plug for my name, and they could not. So like some other, I would say some popular politicians plagiat for my thesis. However, they didn't succeed. And I'm very proud to say this publicly. They screened my doctorate and they could not find any plagiat. So this is...
That's mean.
Yes, yes.
That's mean.
They try a lot, all what they can do to intimidate, to attack, of course, me personally. However, I have the science behind me and very strong colleagues and a massive, fantastic support by really good people. And this takes time. It's okay.
Respect. Brigitte, was there a point in your work when you thought about giving up, saying, well, that's too much pressure, that's it for me?
Well, there was a time when it was too much pressure, when they tried to basically blackmail. They sent emails and they sent faxes and everything like this, saying, well, we don't want to have an NGO, non-profit organization basically starting to get into the healthcare market. It's competition. We don't want to have competition from a private side. And they were feeding against us many years. And that was a time when it was very difficult. And then we started in saying, okay, we won't give up, we make a business case now. And we did. And after that, they accepted that it's in their advantage as well when we work together and collaborate.
Carolyn, in the US, do you have similar experiences that people really are that personal, attacking you for what you did? Like these girls have?
No, I can't say that I've ever had anyone attacking me, but I would say that they just didn't join the bandwagon. They were still focused on finding that magic bullet, on finding the cure, and on not getting aboard with prevention. Now, the one place where I think we have had some slings and arrows is in the area of lung cancer screening. And you may or may not know that there was a very large clinical trial that was ended about 1.5 years ago, and it proved that lung cancer screening using low-dose spiral CT scanning is actually very effective in reducing mortality from lung cancer. But it took about 15 years of fighting that war until the study was released to validate what many of us knew, but we needed the study to prove it. We knew that if you find a lung cancer early and you treat that lung cancer early, you probably will save that person's life. Whereas right now, 85% of people who are diagnosed with lung cancer die of their disease within 5 years. So I think this will be one of the great successes of the 21st century in terms of reducing cancer mortality. Lung cancer screening is one of the ways we're going to do that. So when you come back to me in 5 years and say, what have you done, what have you accomplished, I will say that through lung cancer screening, we have been able to reduce significantly the #1 cancer killer globally. We're not just talking the US.
Christa, was there a point in your work when you thought that was it, I would like to give up because the personal pressure is too high?
I find new ways. I find new strategies. I find new networks. So I always find a way to overcome these hurdles, even if it takes me 10 years. Just last week came out a new legislation proposal, and we have been fighting for an invitation scheme. That means everybody should be invited personally by letter at home to undergo screening for colorectal cancer. And this new legislation proposal said now they will get this invitation scheme as law. So that's a big success. And it took me a long time to come to there.
Cornelia, you just came back from the United States. Is it an advantage or a disadvantage to be female doing what you guys are doing in preemptive politics? Is it easier being a girl, or would it be better being male, or what is it?
It's been vastly different. I mean, I came out of a research institution where about 60% of the faculty, so the professors, were women, or even more. In epidemiology, it's a very female profession. And I came to Germany, and at the university clinic, there were 6% female professors. So being the only one in a room full with very impressive medical doctors was always a kind of a real culture shock. And the additional culture shock was the hierarchies that existed here and the lack of ability to take people seriously, who sometimes...
That bad?
It was sometimes that bad, yeah. And you know, I think it has to do with the field. I think prevention often deals with epidemiology. Epidemiology is an observational science, such as, for example, astronomy, which everybody considers a real science. But for the laboratory scientists, this is not often considered a real science. And that has come up sometimes, yeah.
And how do you deal with that?
Well, sometimes I laugh, sometimes I make jokes. Often now I recognize there are some people who will never change, and the others who I can change. I'm going to show them just some very interesting data. For example, when we talk about treatment of cancer, we know that certain mutations in the tumor matter. Now, I just showed them recently, okay, there are these impressive curves with these tumor mutations and whether people die or not. And I just showed them, well, here's another factor. Look, here's the same rate of death, and it's the same strong association. What do you think it is? And they thought and couldn't figure it out. And I said, well, it's smoking. And so it just shows that our health behaviors matter, and epidemiology matters, and what we do matters, and it's just as important as what happens in the lab. I have to say, I'm married to a lab scientist, so I have had always a lot of interaction and communication that way already, and quite a bit of experience.
But why are so many women on the helm of preventive organizations? Just, what's the reason for that? Brigitte? Sorry, I didn't get the... Why are so many women leading these organizations, these preventive organizations?
I think in the non-profit sector you see a lot of women. I mean, like in social, whatever, jobs or something like this. Especially when it's on the top management, you see in the NGO sector much more women than in the for-profit world. Like CEOs, you see, around the world, you see more women on that side, on the CEO level, than in the for-profit world, in the economic world. I think it's passion, it's more content-driven, it's not that competitive in the sense of you have to show who you are. And I think women are more content-driven in that sense. They're not competitive on that side, that you have to get an award, you have to be somewhere on the scene or something like this. And it's not a money issue. And I think that's the difference, because working in this area, you don't get really high salaries, but that's not the point.
Yeah, Carolyn?
So I believe that women can still be considered leaders of nonprofits, and that they can be recognized for their leadership in the nonprofit world. I agree that we can't be motivated by profit, because the nonprofit world is not a lucrative profession. But I really liked what I heard Alanis Morissette say this morning when she alluded to the fact that women are drawn to a life of service, but they can still be the alpha dog, even if they are in a profession that is a life of service. They don't really have to, they can still be the leaders. And I thought that was a very important observation.
Christa, are you an alpha dog?
No. I mean, I want to point out another thing. It's mission. Women are mission-driven, I guess, much more mission-driven than men. And prevention is a mission. And everybody of this round comes from a personal background, has a personal experience why she started that and has that mission. So you all nod, so I did say the right thing. Huh?
Are you an alpha dog?
I can confirm Christa's observation. I would say when I'm looking in the eyes of my dying lung cancer patients, during my clinical times, I was so deeply touched, emotionally touched, that I decided I cannot continue with this work day after day and doing absolute nothing in prevention. And also, especially the lung cancer patients, they always said to me, why you don't do more in information, in education, why you don't start in schools, in the kindergartens and everywhere to inform the public. And I found this was a mission coming from my cancer patients, and I went through, and it was personal, really very deeply personal, emotional, touched soul, yeah.
Cornelia, what's your mission? Are you an alpha dog?
I thought you would ask me whether I'm an alpha dog. Yes, I'm an alpha dog. I think I started leadership functions early on, but it was always integrative leadership functions. I started at the university to start the European Student Association, and it brought together people from different countries. The next one was the Student Public Health Association, bringing people in from different disciplines. So I think what makes the female approach is probably also this team building, this integration, and the ability to bring a team of different people together and make them feel appreciated and make them feel fighting for a common cause as a equally appreciated, equal member team, not the one, the alpha dog down team, do this now. So even though I have to be an alpha dog all the time in other environments, I try to be the more feminine team leader when I can.
But what is that, a feminine team leader? Is it like an alpha dog upwards, or how do you?
Yes, horizontal and upwards have to be an alpha dog.
I didn't get that.
Well, it is. I'm surrounded by alpha dogs. If I was not an alpha dog, there would be no resources for my department, for my mission of cancer prevention, etc. So I do play the game as I need to.
Is it different to run like a for-profit organization than to run a non-profit organization? Caroline?
I would say very much. But there's some similarities. We both have to market products. Our products are our services. And the difference is that we depend on the generosity of others to support our efforts. So we have to be communicators of our messages and our mission and be effective at that in order to raise the funds that we need to fulfill our mission, whereas a corporation can market a product such as the $10 billion that the tobacco industry spends on marketing cigarettes every year, and they can be very effective at it. So there is a difference. Those smokers are not buying cigarettes because they want to make a contribution to the tobacco industry.
Brigitte, everybody who does not know who Brigitte is, she's kind of Bertelsmann. So could you imagine running Bertelsmann the same way you run the German Stroke Help Foundation?
Between a media company and a stroke foundation, it's a small difference, no. Well, it's a company, and you have to be successful in a different way. There are different indicators of defining success. But still, I mean, you have to go to the market, you have to be the voice for the consumers or the patients in that sense. You have to deliver in different time periods. And you have to convince the people that they really give the money for a quality cause. And I think that's not much different than you have to sell a CD or a book or whatever. In that sense, it's a different mind-driven conception, because health is something given. And normally it's not like you have to pay for it, at least not in Germany, because it's paid by the insurance. So it's a different mindset in terms of reaching to the customer, saying you have to take care of yourself, and then you might not get to a stroke, or you can prevent a stroke. So the self-educational process in terms of reaching the customer is very different. But I think running the company or running a non-profit organization is very similar.
We talked a lot about female issues, the female approach. In Germany, we have the top politician is very female. So would you guys say that Germany is a female country in terms of politics? So are we there yet? Christa, you are laughing.
Not yet, I guess, but we had very strong females on that particular conference here. I mean, this morning, imagine yesterday morning, and you heard Ursula von der Leyen talking about her father who has Alzheimer. I mean, she's such a strong woman, 6 children, and she talks in that way about her father's disease. That was really moving. I think we could have some more women, yeah. But we are not yet there.
So what does society need? What kind of female approach to get better, Caroline? What female approach does society need to get better?
Society needs to, I think, adopt the fact that females look a little farther into the future. I mean, just consider the one example of giving birth. It takes about 10 seconds for that male to start the process, but it takes 9 months for the female to complete it. So society needs to take a more futuristic approach to disease outcomes, that we can't cure them instantly, that we really need to prevent them. That would be one thing I would say.
Okay, good. Cornelia.
Well, whether we're there yet, I was just thinking of this yesterday again when I was traveling and I went into the airport lounges and I was like in the Senator Lounge, the one of 30, 1 woman, 30 men. And I think as long as we don't have an equal number of business women traveling and being present in those lounges, as long as we don't have like the newspapers that are presented, the magazines showing every person who's responsible for business being a man, every person who is looking beautiful and sexy being a woman, like that's what I just perceived as pictures in Germany again, where we have still so many perceptions that are still far from being there. We had a panel discussion for junior women at our cancer center, and I was very surprised to see that there were at least 30% for whom even the idea of having a career and kids, far less even science, was not even an option. And we're not there, not in Germany yet.
Is it different in the US?
Yes. And in Israel and in other countries, women are part of the political as well as the economic as well as the scientific life to a much greater extent.
Except at the very top.
Yes.
Well, I must say, it's really true, and our women and we must be much more visible and to speak loud and louder. And I think the DLDwomen conference is really a fantastic opportunity to learn from each other and to inspire each other and also to help each other, to support each other. So thank you so much again to the organizers, to Steffi and to Maria. Thank you so much.
At this moment, we would like to take some questions from the audience. In case you guys would like to have a tip or a hint please feel free to ask. If you always wanted to ask Caroline something, or, yeah, please, somebody with a microphone. Please introduce yourself.
Yeah, my name is Ernst Pöppel, and I would like to take issue with some concepts here. I think to argue that most men, all men, are insufficient to make these causes you describe here, it's just a disaster. You should include those men who have the same opinion. I think men, this is a statistical argument. Pardon me?
They don't want to be included. Not in prevention.
Well, if you separate men and women, yeah, this is not true. That's the statistical data we are talking about. There are many men who represent the knowledge women have here. So include those guys and don't push them away.
Thank you.
It's done.
Who would like to answer that question? Who would like to answer, Caroline or Cornelia? So why don't you guys include men? That was the question.
I want to draw attention to my comment previously that I said that men can do this just as well, and that I know many esteemed colleagues who have done things quite well. But there is a preponderance of women in a field that has less payoff and heroism. And that is true, but there are many who still have done great work, but nevertheless, I think we have a female attraction to this field.
And I think we weren't excluding completely men. I think we were just talking about why there are a disproportionate number of women who are leaders in this field.
Also, I can add that I have a very large network of men, only men, to support the cause. I'm not sure that they would be on top of such an organization which I run, but they are willing to support the cause and to build a large network of supporters. So that's very good. I'm very good with men.
Another question, please. Who would like to ask a question to Brigitte, to Monica, to Caroline, to Christa, or to Cornelia? So now is the moment. Maybe you should ask if you want to know how you get a job in Seattle. Maybe how she came back, why she came back. We did discuss that. There's somebody in the back? Yeah, okay. The microphone is coming. Please introduce yourself and...
Hi, my name's Lucy Cooper. I work for Random House and I'm from London. I have a big personal relationship for cancer in my family. And in the UK, I think that the NHS and other institutions aren't set up appropriately to support people who want to be screened. And quite a lot of the time I hear that people are turned away and told it's probably not a problem and to come back and you're too young or you're not the right segment of society who is susceptible to this disease. You know, I'm in my 20s, I get screened all the time because of my family relationship, and I have some of my friends who would like to do the same thing because they're worried but they're turned away. So what can be done to interact with like public health organizations like the NHS and other state health societies
in the UK?
Way? Anywhere in the world. I'm sure it's probably not just
Christa, you'd like to take that?
My belief is you have to solve this legally. I mean, you have a law for this. You have to have a law for this. I give you an example from colorectal cancer screening. There is if you have one close relative in your family with colorectal cancer, you yourself are at a much higher risk to develop this disease, and you develop it earlier and more frequently. And there is no possibility that the public health insurance pays for your preventive colonoscopy up to now. So this has to be solved legally, and I hope they will put it into the new law. At least they had a paragraph in it saying that it could be possible. So that is one point we are fighting for. Otherwise, you can't solve that problem.
Thank you. So another question. We have time for one or two more questions. Yeah, in the front. Is the microphone coming?
I would like to know how is the situation with
Could you introduce yourself first?
Yeah, I'm Mari Medeiros. I'm from Munich. And,
a little bit closer, the microphone to the mouth. We can't hear you.
I'm Mari Medeiros, and I'm from Munich. And I would like to know what is the situation about the vaccination against uterus cancer for girls. What's the experience?
It's for cervical cancer.
Yeah.
Cervical cancer.
Yeah.
Who wants to? Caroline, Cornelia?
Well, in Germany, unfortunately, the vaccination rates are very low, and it had to do, unfortunately, with the fact that after the introduction of this vaccine, which effectively inhibits the virus that can cause a lot of infertility as well, and uterine cervical cancer, that it was put down by a panel of self-named experts as being very dangerous and risky. And the real experts said it's not true. They showed all the data, but by then the horse had already been out of the stable, ran around, and that means basically in the public the mindset was this is dangerous. It's very sad that we actually have here something that's so effective against a major killer and a cause of infertility for a lot of women, and that it's not taken up as rapidly in Germany as it should be.
But this exam is paid in Germany by public health insurers for, I think, girls beginning age 12.
And in much of the United States, it's not paid for. So it depends on where you live. as to whether girls are vaccinated against cervical cancer, which is really a shame.
And why is it like that? What's the issue?
Well, you know what our healthcare system is like. It's very fragmented, and even with the new healthcare reform, the Affordable Care Act that was just affirmed, thankfully, by the Supreme Court 2 weeks ago, it will remain fragmented because many of our states will take advantage of a loophole in the law, and they will opt out of accepting extra Medicaid funds to help insure the uninsured.
I think we Germans will never understand the American health system, but that's a different issue.
Nor do the Americans.
Cornelia?
Well, actually, I wanted to say something to another point. Is that a good moment? Because, you know, one thing that I have to say that coming from the US, I had never been active in women's issues there because it wasn't really necessary. And then I came here and I realized that there's a lot of room to be a role model and also just ask naive questions. Why not this? Why not that? Why can't we do this? And it was amazing to see this difference. But what I also would like to communicate is that we don't want to take over the world as women. We just want us to be a normality in leadership positions, that it's just a normality that we're here, that we are in science as much recognized and available and as leaders as in business, and that it's not a question anymore that we need to discuss.
Thank you very much. I think that was a good quote for the end.
Let's come back in 5 years and see what's happened.
Okay, we do that. Ladies and gentlemen, thank you very much for being here. Our topic was preventing disease, a female issue. Thank you very much for Christa, Maar, Carolyn, Ulrich, Brigitte, Mohn, Cornelia, Ulrich, and Martina Pötschke-Langer. Thank you very much, and thank you for your patience.